The delay between the first symptoms and the diagnosis is long in IPF. The patient first may take a long time to visit a physician because the condition starts very progressively with mild dyspnea or with mild cough, so the patient may wait before he goes to the physician, and also because most often patients feel that something is going wrong, but they fear of what the doctor may say or may find. The first physician involved in the diagnosis of IPF is the clinician pulmonologist. Very often the patient goes to the general physician who may diagnose some lung-related lung disease, and sometimes suggests the diagnosis of IPF because he can hear crackles at the lung basis on pulmonary auscultation, and this is a very important physical examination sign. The other examination sign that he may discover are the digital clubbing, finger clubbing, which is another important sign, but less present in about 40% to 50% of the patients.
So we know that early referral to expert centers for IPF increase survival as compared to patient non-referred. So first you want to make the correct diagnosis as soon as you can, because this patient, they can actually have a different diagnosis, a different disease. And so it's intuitive that the earlier is the diagnosis, the more is likely that your interventions will be effective. So when I say intervention, I do not specifically mean drugs. I mean first to avoid the use of drugs which are not helpful or they can be harmful. Then the other reason for having an early diagnosis is that as far as we know, IPF is a progressive, irreversible disease. So the rate of progression might be different in different patients, but they all progress.
The sound of Velcro can help the physician to make the diagnosis of IPF because this is an abnormal sound that we hear very early in the course of IPF. So for example, if the patient at first visit for cough or for some mild shortness of breath has an abnormal lung auscultation with Velcro rails, this is very suggestive of interstitial lung disease and especially of early IPF. And a lot of patients already have Velcro crackles on lung auscultation, whereas the lung physiology initially is still pretty preserved.
So for all of these reasons, I think that one of the best thing that a doctor can be for their patient is to make an early diagnosis as early as possible of IPF.